Dr. Deyhimy, I will turn it over to you for a brief introduction of what it is that you're doing here, and then we're going to get to the speaker that has a testimony of the MAT program and the success that he has had with it, and then we'll open it up for questions.
Okay, this is, I think, our fourth week of doing this, and just so happens that with everything going on in the community, I have a lot more time than I used to have in terms of being at home and working on other projects such as this. So I'm the medical director of MYMATCLINIC, which is an outpatient office-based MAT clinic in Laguna Woods. And we work with a number of patients, not only in an outpatient setting, but we also work with patients who are currently in structured residential and or outpatient drug and alcohol treatment programs. And my partner, Jeanette Spivey, who's on the call today with one of our patients, she and I have been doing this together for, it's getting up to be almost the better part of 10 years now. Lots of experience working with treatment programs, providing them a full range of services from detox to outpatient. And increasingly over the last few years, people's understanding and awareness of what MAT is, medication-assisted treatment, and what its role is in addiction medicine is becoming more and more talked about. Yet there are still big information gaps in terms of, what it is, what it isn't, who should have it, who shouldn't have it, what the evidence for it is, and, actual, stigma towards it, because different people feel that there's only certain ways to be clean. And we come at addiction more as a chronic disease where these medications can help with the chronic disease by improving a number of things and improving retention and treatment first and foremost. So that's a brief sort of overview, and I'm happy to talk to people and educate them in any format that works. But this seems to work real well for people lately, so we're just kind of going with it each week.
Awesome. Thank you, doctor. So at this point, I would love to introduce our speaker. There with you, Jeanette. Can we get an introduction, please?
Hi, how are you?
Doing well. How are you?
Good. So
Excellent.
I have Joe with us right now. He's like literally one of our favorite guys. Well, he's actually my favorite guy who has been on, he's cracking up, has been on Sublocade now for, I don't know, how long has it been?
5 total injections, and I'm here in the office today and just got my 6th. So a little while, 6 months. And my story is, I've been a heroin addict for the last 11 years, starting with, it all started with opiate pain pills and progressed over like a course of 2 years to injecting heroin. And, I've been to multiple, I've tried all different ways of trying to do this and trying to get clean and sober. And over the course of, that time, and nothing is really, it's just been a struggle. I've tried all sorts of inpatient, outpatient therapy, rehab. And, I've tried 12-step meetings, and that's, it's beneficial. And, but this time I've just noticed a huge difference, a huge change, ever since I've been getting the injections. And it's, for me, what it does is just completely takes away the, I guess you would say the obsession, the mental part of things. And for me, and the difference between the oral and the injection for me is like, I don't have to think about taking a pill every day, and I don't have these ups and downs all the time. And that's it's been super beneficial to not have to take a pill every day, and not only every day, but every couple of hours, trying to like monitor where I am. And that's the most beneficial thing. It's like you get it and you just forget about it basically for the rest of the month, and until, you come in for your next visit. And I don't know. I don't know how to say enough about it, really. Because my struggle has just been so, I don't know. I've been everywhere. I've been in jails, every institution in Orange County, basically, and nothing is giving me the relief as this injection. So I just, if you guys have any questions, I can't say enough about it, really, and I can't thank the doctors here enough, really, for all their help and support.
Yeah. So Joe actually it took a long time to get him on this medication. We were paying like tag for quite some time. And when he finally did come in, he actually slept in our parking lot for 2 days because it was a weekend. Mm-hmm. And, Jill almost Narcaned you.
Yeah.
But it's just been so remarkable for him not having to think about it. And that's the biggest thing. I think we have your mom on the phone. Where is your mom?
Hi, I'm Jana, Joey's mom.
Hello, Jana. Thank you for tuning in on the call and supporting your son in this. It sounds like he's made incredible improvements. And one thing that I heard him say was it takes out that kind of routine and that ritual of having to take those pills every day or every few hours, right? And I think that's such a huge importance because with the drug addiction, it goes, with the routine and the ritual. I think taking that out is a huge aspect of it, which is one of the things I think is so beneficial about the MAP program. In terms of loving a family member, having your son sober for 6 months, I mean, how incredible does that feel? And what have you seen a change in him?
Oh, I can tell you, it has been an absolutely remarkable change. And, I'm really emotional right now, and I'm sorry.
It's understandable. It is.
Yeah. I haven't heard, Joey talk about this, for the last few months because we pretty much have given up on him. Mm. Yeah. And he knew that. He has struggled with this for 11 years, and we have done everything that we possibly could. We thought, to every facility, from Betty Ford to however many there. I don't think there were any more facilities in Orange County that Joey hadn't been to. And nobody wants to, be a drug addict, obviously. And, he has tried every single thing that he could. And this is the only thing that really has saved his life. And he is back being, the person that he was before he started doing this. And he's thriving in life. And I think that you can just say that from what I understand, when you are a drug addict, you think about using about 5,000 times a day, which for people that aren't, they can't understand that. And being able to take that off of you, I really feel like it has given him the opportunity to, be a citizen in the world again and think about other things other than using drugs. And I mean, we've seen such a difference in him. It's amazing. And every day I just pray that this shot doesn't go away. And I wish that everybody could have an opportunity to experience it. And, every family, that has been broken.
Yeah. That's powerful. Absolutely. And I think as a family member to feel that comfort is so important. And I think probably a lot of the loved ones in this room can understand that feeling of wanting that comfort or having that comfort for those that are in recovery. Joe, for you,
I have it marked in my.
Go ahead, please.
Well, I was just going to say, I have it in my calendar, every month around the 20th, he's got to get his shot and, just to make sure that we keep the ball rolling. And I know that, eventually he'll wean off of it and lower the dose and that kind of thing. But I mean, even to the point where Joey used to bite his fingernails so they almost bled, and his fingernails are so long now, you have to clip them.
They are.
Just all these things in your life that you can see, but you really can just see that he has an opportunity to think about things other than using drugs. And then when he was trying the tablets that you would take, if you think about it, if you give, 70 pills to a drug addict, well, who's going to really tell you that, he's only going to take one or two, like maybe they tell him to? And if he's having a bad day, I'm sure he would take more. Or how many times do they go sell them? There's a lot to be said about, the control of having an injection as compared to giving them a bunch of, pills.
Yeah.
So it has made such a difference in our life, and especially in Joey's life.
Yeah. Yeah.
We can't say enough about it. And we're so happy that we found you guys and found Jeanette and Joe. It's
awesome.
Helped us, that's for sure.
Yeah, that's amazing. Thank you so much again. And Joe, like that level of comfort that I was saying, like that protection almost to know that like you don't need that ritual and that routine. Like how has that opened up your life for other aspects to flourish, like in terms of getting a job or in terms of, finding hobbies and passions or relationships? It's got to be a weight off your shoulders to not have this, like every day, a weight to have to worry about. Right.
Right. It frees up a lot of my time, because all of my time was spent on, making sure that ritual was getting done properly and adequately to whatever my mind was telling me. And I really never had the freedom, or felt like I had the freedom from it, or understood what it was going to take to get that until this. And now it's opened up, this right now it's hard because I've been really wanting to go back to work, but I can't go back to work because I'm a full-time licensed barber. And right now with the virus going on, I can't, be doing that. But as far as my relationships have gone, like my mom said, pretty much my whole family was just waiting for me to basically die at any given day, any given point. So they really had distanced themselves from me, and because for their own sake and emotions and whatnot. And now it's, which makes like getting clean and sober even that much harder and that much tougher. And now I've got my family back. I've gotten my relationship back with my girlfriend, soon to be fiancé. She's been through the struggle with me for the last 3 years of it, and we have a 5-month-old daughter together. And I've been able to be in their lives, and I'm slowly working my way back into their lives, and hopefully to make that a full-time thing where we can, where I can be a loving, caring father as well. And that's really big for me. That's one of my major goals. And I got sober just 2 weeks. The difference between her birth and my sobriety day is roughly about 2 weeks. And, that has a little bit to do with it, why I want to stay clean and sober, obviously. But
how did you find this? Oh, Scott.
Oh yeah, Scott referred me to you guys. Yeah, I was referred to you guys through Scott, and he's been a big help. And he's never gave up on me either. He's somebody that is, always was there in times of crisis with my family and stuff like that.
Could we know who Scott is? If you guys explain who Scott is.
He was actually, I think it's more about that. Scott was kind of mentoring him and, trying to be the one that kept you together and straight, do counseling, that kind of stuff, and send you to some of the other programs.
Yeah, it was almost like
almost like a case manager.
Almost like my or
like a case manager,
or like a sobriety sort of manager. Because my mom was just so fed up with trying to get me because she would do anything to help me, but was just tired of me failing. And so Scott was kind of there as like a buffer between me and her to try to figure out what was really best for me and what we could do, I guess, is sort of who Scott is in my life, And so I found out about the shot, and I found out about Dr. Deyhimy and Jeanette, I came here for a consultation, and then I ended up going to jail in between the time that I was waiting to get my first shot and my first consultation, because I could not stay sober for the life of me, and so I was actually I got out of jail, and then I was court ordered to go to a program, but that program wouldn't allow me to be on maintenance. And I had been on maintenance, the pill form for a long time that I just didn't, and this place is just very old school. The owner wasn't open to the shot or to any sort of maintenance treatment at all. And so they actually just dropped me off on the corner of Harbor Boulevard, and I didn't know what else to do. So I made my way back to Santa Ana, continued to get high for a few days, and then realized, like, what am I doing? I can't do this anymore. And then I had remembered that I went to see Jeanette and had got the ball rolling, and I was just praying that they got my injection in. And so I walked more than half the way from Santa Ana down here to Laguna Hills, and luckily got picked up by some people in the program that found me sleeping in a Denny's, where I lost my wallet in that day also. And I was just trying to figure out any way to get here, because I knew that Jeanette would help me, and I just had this feeling that the shot was, I had tried everything else, but the shot was the one thing I hadn't tried yet. So, so then I ended up hitchhiking the rest of the way, and of course it was a Saturday, so the office wasn't open yet, and I ended up writing a little note and put it where the labs get picked up, and I slept in the parking lot for a couple of days, and in this area, just waiting for them to come to work on Monday. And then about 10:30 Monday morning, I basically collapsed in the back because I had been up for a few days on methamphetamine, and luckily I didn't have opiates in my system, so they were able to give me the shot that day.
And the nurse that walked in there.
Yeah. And they thought that I was dead in the back because I just collapsed, because I was just so exhausted and tired from the walk and from being up for days and what I'd been through. So, yeah, it was a very intense that month was probably some of the most intense times of my life.
Wow, that's such an incredible story, and it sounds like along the way you had so much support and a little bit of luck, right? And some absolute care at the Mac clinic there. When you went there for that consultation, you got some care, and that's awesome. Dr. Deyhimy, yes.
Yeah, I mean his story is incredibly frustrating to me, because it's utter bullshit that somebody who's offering you treatment would drop you off in a corner, endangering your life because what they're offering isn't consistent with what you want. Could you imagine in medicine if patients came to my office and I had an ideologic one-size-fits-all way of providing medicine, and if that didn't fit with them, then I'd kick them out of my practice, or better yet, drop them off on a corner?
Yeah.
I mean, that's a
criminal.
Yeah, it's absolutely atrocious. And so I mentioned on the outset of this that there's stigma towards MAT, and if that's not a perfect example of what we're talking about, then nothing is.
Absolutely.
Treatment has to be individualized to patients based upon what their belief systems are, what has and what hasn't worked before, what their medical considerations are. By matching it to patients individually, you get much, much better outcomes than shoving people into a one-size-fits-all model, which is basically what most of the drug and alcohol addiction industry is. It's a one-size-fits-all with most programs, and we call it one-size-fails-most. Mm-hmm. So, and that's why kids like Joe here go through programs over and over and over again and have a 95% relapse rate, and along the way, a whole bunch of them die. Because every time somebody's been detoxed and then they fail and they get dropped off in a corner, or they leave, AMA, and they start using right away because they haven't truly been treated, they're essentially opiate naive at that point.
Yeah.
And their receptors are all wide open, and somebody gets, some fentanyl in their heroin or stronger heroin, and they're just dead, just like that.
Mm-hmm.
And I think a lot of that responsibility lies with the programs that discard patients when they're not, meeting their model. It's their model fails the patient, not the other way around.
Yeah,
so,
absolutely.
Anyway, that's my
I couldn't agree more. Jody, we have a question from Jody, and then I'd love to open it up for more questions for Joe or for the doctor. Hold on, Jody, you're muted. 1 second here. If we could get the host to unmute Judy, Judy, sorry. Or Jody, if you could unmute yourself, that would be great. There we go.
Hi.
Hey, Jody.
Hey.
Welcome.
Hello. Hi. I just want to say thank you, everybody, for being here. And I want to mention, another reason, too, that they relapse is because they're not in treatment long enough to heal their brains, right? A lot of them, the young adults that call me or the moms that call me for help, their kids are on scholarships a lot of times. So they're only in for 30 days. And then they have to, and then they are let free and they say, go to meetings and get a job. And 30 days, no. 60 days, no. It's just not going to work. Their brains need to heal and they need more help. And so, yeah, naturally, they're going to still crave their fix and they're going to relapse. And that's like, it's just a vicious cycle for so many because they're not in long enough. I've been advocating for long-term treatment. And that includes the MAT program, getting Sublocade after rehab, maybe after sober living, get on the Sublocade and stay on that for a while, just to get their brains to heal long enough. Right.
Yeah, absolutely. So
that's
it's like
what I'm seeing.
It's negligence in treatment and then negligence after treatment as well, right? I mean that's kind of the big issues that we're seeing. Whether it's not offering something and having that one size fits model, or it's not having them stay long enough and kind of kicking them into the streets without the tools. And the combination of both is why we see, I'm sure, such a high relapse rate. Absolutely.
Taylor.
Yes.
There's another thing though, that drug and alcohol treatment programs offer an artificial environment to the patient. Right? All of their needs are being met. They're being housed and fed and taken to the gym and taken to meetings. And so that is not how life works. Now, what I like about programs, especially the good ones, is they have behavioral structure embedded, which is very, very important. But when somebody goes through 60, 90 days of programming and then they just say, okay, now you're on your own, go find a job, a place to live. Here are the numbers of some meetings. Oh, by the way, you don't have a car. You have multiple warrants for your arrest. You have no job. Your parents have dumped you because they're over it. You're going to fail 100% of the time, or virtually.
Yeah.
You need bridges, sort of scaffolding to recovery.
Totally.
And the other thing is, and Joe couldn't have put this better, is that this constant preoccupation with using, that might diminish somewhat in a controlled setting, but when you're back into the real world with all of its real stressors and all of the wreckage of a life that you had before you went into this program, those thoughts come back and they come back with a vengeance. And you're having to think 5,000 times a day whether or not you should use or not. And that's impossible for even the strongest of people to handle. At some point, you just get decision fatigue. You can't do it anymore, and you just want the pain to go away. So you use. And this is why MAT meds work when they're done right, is that they diminish this repetitive thought behavior. They stabilize the cravings, and they give your brain time to focus on other things that you can work on to improve your life. And I mean, that's pretty much exactly what he said. And it doesn't just have to be the shot. It's just the shot has so many more advantages over taking your sublingual buprenorphine twice a day. Again, because you have to make less decisions a day when you have an injection in you that lasts more than a month.
Yeah. Absolutely. Does anybody else in the room have any questions for Joe or for the doctor at this point? Bonnie, yes. Bonnie, and then forgive me, I'm going to call you Pants one more time. I'm so sorry. And we'll get your name again, and then I'll remember. You have my word. Go ahead, Bonnie.
Thank you very much. Thank you so much for this group. And Joey, congratulations. Your story touches my heart beyond belief. My son is 33 and he has been a heroin addict for probably 10 plus years, and has been sober since January of last year, so about 15 months. He is on buprenorphine. My question to you, doctor, and Jody was just mentioning about the brain's ability to recover. And my question is, does your brain have the capacity or the capability to regain your cognitive ability pre-heroin use? I don't know if I'm saying that right.
Yeah, I knew what you're trying to ask.
Thank you.
Can you get back to the days before you used any drugs to cope with stress and pain and whatnot, right?
Yes, thank you.
And, that's a really hard question to answer because everybody is different and everybody's circumstances are different. And I'll say this, 50% of people that have drug and alcohol problems have at least one coexisting diagnosable psychiatric problem, if not more. 50% of people who have one parent have a significant genetic predisposition towards drugs and alcohol. And as we get older and our brains mature more, there's like way more stress and responsibility for us to deal with. So it's hard for me to exactly say like yes, no, because it's just as we grow, like so do our circumstances and the stress we have in our lives. But I'll say this is that brain remodeling does occur, and long-term drug use and opiates, they hijack the midbrain and they cause neural changes in the neural circuitry in our brain, especially the ones around reward. And this all has to do with dopamine and reinforcement. But the bottom line is you become increasingly preoccupied with reward. And after a period of time, your frontal cortex of your brain that is involved in higher decision making, like weighing complicated decisions with consequences, isn't part of this decision making process anymore. And when you're on the proper medications and you're going through treatment, that can remodel again. You can get the frontal cortex involved. You can start making better decisions about, should I do this? Shouldn't I do that? Short-term reward versus long-term, reward, and things that substance use patients are dealing with every day. So I guess the short answer to this is absolutely improvement can come with time, but it takes months and months of sustained sobriety for these changes to come about. And then something that we're very big proponents on is that you have to replace the dopamine through natural, methods, right? So exercise, relationships. Joe mentioned how he was motivated because he had a child on the way. Getting that great job that you don't want to lose. Reestablishing a solid relationship with your family and friends. These are all like natural ways to produce dopamine in human brains, and they all get hijacked by the drugs. So you give up all of those healthy behaviors that don't produce huge amounts of dopamine, but in aggregate, they produce good amounts of dopamine, the ones that are important for survival. That all gets hijacked. And so you have to get back to these, natural ways of producing dopamine. And for some patients, that means they can go off of their MAT meds. And for others, it means no, they don't. They just stay on those because those are helping augment the dopamine in their brain.
Okay.
Does that make sense?
Yes, thank you.
Makes sense.
Hey, Doc, we got a question that came through the chat here, asking you to speak on the recovery time prior to introducing Matt.
What does that mean?
It says, I'm guessing.
I'll unmute myself.
Okay,
Hi.
go ahead. Hi.
So I was actually wondering thoughts. I don't know enough about the literature or if there is any empirical literature I know there's different types of MAT treatments, and I know some of them can't be introduced until someone's without opiates for a period of time. But on introducing different camps of them after someone's had 2 months sobriety or 2 weeks sobriety.
Okay, yeah. I mean, so it's the different medications, work by different mechanisms. And so some of them you can't introduce until the patient has been sober or when I say sober, let's just say off of opiates. Because were you to introduce like naltrexone or buprenorphine too quickly, you could put them into precipitated withdrawal. Buprenorphine much less so than naltrexone. With the Sublocade injection, we need patients to be tolerating buprenorphine sublingually for at least 1 week, if not a little bit longer. And we need to have them on a minimum of 8, but preferentially more like 12 or 16 milligrams before we give them the shot. So if somebody's been in a treatment program, let's say 2 months without any MAT medications, and they're about to get out, just like Jody suggested, should they maybe be on the medicine? And let's say they're about to get out and they're getting stressed and worried and having cravings because they know what they're going to be facing, they can absolutely get started right away on naltrexone. And if they want to be on buprenorphine, they can start that immediately as well. And then after a week or two, we get the injection for them and they can come in and have the shot.
Thank you. That was perfect. Yes, I appreciate that.
Cool.
Awesome. Thank you for your question, Don.
Joe? Hi, Joe. I just want to say good job.
Awesome.
And I just want to mention too, when you, at some point, go online and watch a documentary called Overtaken 2. It's on YouTube. It's a documentary that I produced. It's the message of hope. And it shows a lot of young adults in recovery like Taylor doing really well, clean and sober, what their lives are like today. If you want to watch Overtaken 1, that's the first one. It's the same people and what their lives are like when they were struggling with addiction versus Overtaken 2, the message of hope. Now they're off these drugs and their life is so much better. And they're staying clean and sober.
Yeah, I've actually seen both of your videos, and I've seen you speak at a couple of the treatment centers that I've been to. And I actually went to school with your son. So I know actually a little bit about you. And yeah, I think what you do is great. I think it's good that you go and inform, people and their families and the struggle that us, or at least our generation, mine and your son's generation went through. It was a serious problem, as you already know, but, and then I just wanted to say something about, long-term, because you were mentioning long-term sobriety. I mean, not long-term sobriety, long-term, recovery, as far as being in a rehab. And for me, I'd been in one place for 11 months, and then I got out of there, and I had like an apartment, and I was just trying to do it on my own and I still failed after like a total of 15 months. And I wasn't on any sort of mat at that time. I was just really just trying to like sort of white knuckle it. I was in a 12-step program, but I was really just trying to make the most of what I could do. And after a while of being in treatment centers, it starts to feel like another another jail in a way, another sort of yeah, really just like another jail. I mean, there are some good ones out there, and they do allow you to go out there and get a job. A lot of them don't. They need you to be there. They need you to be there all the time, and they need you to be constantly going to groups. And it's really hard to navigate when you have time to try to get a job. And because without that job, a lot of people feel trapped and stuck, and like you're like almost as if the treatment center builds a barrier to get out there and really like experience real life. And that's where I struggle too, right now I'm in a sober living, and even for me, I feel like there's a little bit of a barrier. Like I need to be out there and trying to do this life thing. I'm not saying right away, but I think after a certain amount of time, it's good to get out there and just see what you can really make it yourself. Because like I said, it's just such it can be very like trapping feeling, and of course it's hard because your family and everybody really wants you to stay in there because it's a safe place, but it's not very rewarding like being in there. And if you can maintain sobriety, I think learn how to actually maintain sobriety and live your life. That's where like the key to all this is, like finding happiness and maintaining the sobriety. But I realized it takes time, and I think that treatment centers are good. I just, in the beginning, but I just feel like it can be trapping. Like some of them, I just think it needs to be set up differently, and the client needs to really come first, and their needs need to come first, and then build the system around that, instead of like kind of what the doctor was saying, like everybody has this one cookie cutter, one size fits all. It's really not like that,
Have you found your passion? Like what you like to do? Like Taylor loves surfing.
Yeah, I loved surfing growing up, and I still love surfing. But I moved on to hair. I love cutting hair. I love being in the barbershop, and it just so happens that I can make money doing it too. So that's what I love to do. During that 15 months I told you about, is when I got my barber's license, and
that's so cool.
Yeah, so that's what I do now. And here, Jeanette wants me to show you guys. This is a picture of my daughter.
Wow.
Oh,
yeah, that was
so cute. Oh my God. She's darling.
So these are the natural reinforcing things I'm talking about. I mean, these are things that are consistent with life and living and sustaining like an existence or having an existence that's sustainable. Whereas in a treatment program, they have their merits, but that's not consistent with life. Everybody is so different, and they have to find for themselves the things that like are naturally rewarding. And for Joe there, it's cutting hair, and it's his daughter, and it's his relationships. And for somebody else, it's going to be exercise and yoga. But that's why outpatient treatment is so important, because outpatient treatment is realistic treatment. I'm a huge proponent of combining medications with some structure, especially initially, like to attend like a PHP, IOP, learn life skills, how to get a job, how to like do grown-up things that are important, to get by in this world. Those are really important. But the medications stabilize the thoughts and the cravings to allow you to do that. And but ultimately, this foundation has to be built by making good decisions and having behavioral changes that are sustainable. And they work in combination. Remember, MAT is not medicines; it's medication-assisted treatment, meaning medications in combination with behavioral treatment. Because without the behavioral treatment and the change and sort of getting at the underlying reasons why you were self-medicating to begin with, those have to be addressed. Otherwise, you really can't move forward. The medicines are just one part of that process, an important part, but But ultimately, change has to come about by the individual, changing their life in a way that's going to be sustainable.
Yeah, doctor, and I think you touched on something incredible, that action has to be put in, right? As with the medication. But what the medication does is allows us to stop focusing on the drugs and start letting us focus on that action that we need to put in to actually, make those life-changing, adjustments in our life, so we can be there for our daughters, so we can be there for our families, so we can show up with our passion and show up at our job and become a sustainable part of the community, correct?
That's right. And the lines from your first day of sobriety to sustained sobriety is not straight. It looks like a stock market ticker symbol. It is going up, down, up, down. There are relapses in there. There are slips. There are all kinds of things that happen that can be huge setbacks for some people. However, when you're on MAT, those slips are shorter and they're less deadly, and they're often not sustained. We have more than a few patients that are on MAT for opiate use disorder that continue to use other drugs and alcohol, but the chances of them dying on any given day are greatly diminished because they're not going to overdose on those drugs nearly as readily as they would on an opiate. And so you just keep supporting the person little by little, making incremental change. Kind of, we talk about 0.1% improvement is still an improvement, and anytime somebody backslides, you need to be there to support them and figure out, well, why was there a slip? Why was there a backslide? Do we need to increase your medication? Do we need to provide better support in another way, so that slowly but surely over time, the spacing between those relapses gets shorter and shorter, and the severity of them is diminished as well.
Excellent. Morgan, I know you had a question. I would love to hear from you.
Yes, I have two questions. So the first one is there a length of time that someone can be on Sublocade?
No.
So it can...
It's a relatively new drug. It got FDA approval 2 years ago. And there is no you're only allowed to use it for 18 months and you have to stop or these bad things are going to happen.
Okay.
We don't have long-term data on it, but we do have long-term data on sublingual buprenorphine, and it's a very safe long-term medication. Much less side effects than methadone, for example.
Yes. And then the MAT program, is it covered by insurance? And if not, how much is it approximately?
Well, all MAT programs are different. The grand majority of them are not covered by insurance because insurance pays almost nothing for these services. And most programs range from $150 to $250 a month. There's one in Sacramento that I visited several times called Transitions. And it's run by this awesome doctor and his team there. And they're very inexpensive. I think they're like $150 a month, but it's only sublingual buprenorphine. Our program right now, we charge $250 a month, but a lot of that is the legwork that goes into getting Sublocade because my nurses have to go through getting insurance approvals, and this can take hours and hours of time. So our program doesn't even run at a profit. It's essentially a charity at this point that is sort of subsidized by the other work that we do. But this is one of the major fundamental failings of the United States healthcare system. Even though we have, universal healthcare in quotes, mental health services still are not treated on par with other services. And trust me, I know this because I'm an anesthesiologist, and I can go work in an outpatient surgery center and do, elective surgery and plastic surgery and get paid 5 times as much than for doing an open heart surgery on an 88-year-old Medicare patient with numerous comorbidities. And so when it comes to mental health, it's the same thing. Most psychiatrists, for example, in Orange County that I work with, they're cash only because they don't get paid by insurance companies and at least not enough to have them sustain their practices with, rent and everything like that. So right now, most MAT programs that I know of are private pay, but we get the medicines through insurance. And I always kind of somewhat justify it by saying if you're active in your addiction, you're spending a lot more than $150 or $250 a month on drugs. It's more like that several times a week.
Yeah, absolutely. Absolutely. Thank you. Morgan, did you have one more question or was that it?
No, that was it. Thank you.
Okay, excellent. Ainsley, let's get to you for your question, please.
Okay. So my question is, do you guys only deal with opioid addiction? And if not, I'm just curious what you think. Like my drug of choice personally didn't require physical detox, but they did put me on Vyvanse as a relapse preventative. And some people were adamantly against it, but the rehab that I went to was through McLean Hospital in Massachusetts. And they were all for it. And it seemed to work really well for me, but I'm just curious if you guys have an opinion on that at all.
Yeah, absolutely. So MAT isn't just for opiates. It's the biggest problem we have in the country in terms of deaths and medical costs and cost of society. But alcohol is right up there. And there are medications, MAT medications that through many randomized prospective studies have been shown to be effective and in some cases superior to abstinence-based treatment alone. They're working on a number of MAT medications for cocaine, methamphetamine. They're the data on those isn't wonderful right now, but they're moving in the right direction. But what you said was important. Like you got put on Vyvanse. So why is that? It's because you have an underlying, I'm going to guess, that you have some underlying psychiatric co-occurring illness, probably bipolar. And so you're essentially self-medicating with methamphetamine. And Vyvanse is a stimulant, right? It's a long-acting stimulant. And so it's not all that different in its function from methamphetamine, but way less addictive and because of the long-acting nature of it. So to treat a person who has an underlying psychiatric issue with just abstinence is going to fail because you're going to go use your methamphetamine again right away. To put you into a structured program and put you on proper psychiatric medications and then give you behavioral treatment to go along with that, your chances of succeeding just went up a lot. Mm-hmm. Does that sound familiar?
Oh, yeah, that's exactly what they did with me. I mean, I went through a 2-week drug rehab and then I went to McLean Hospital for a 2-week DBT program. I actually have a borderline personality disorder, but they medicated the same as bipolar. So it's all, yeah. So they dealt with every issue that I was having basically. And it worked. I mean, 5.5 years later, here I am clean and sober. So it definitely worked.
Good for you. I'm glad it worked.
Yeah.
A lot of times, almost all the time, our patients don't use just one drug. They use all kinds of drugs and they have their favorite drug. And when their favorite drug's not available, then they go to their next favorite drug and their next favorite drug. And then the other thing is when they go visit their friendly neighborhood drug dealer, he or she is often having specials on all kinds of drugs besides their favorite drug. And so people are polysubstance users more often than not. Alcoholics are one of the exceptions. They tend to just be more alcohol. But marijuana, Xanax, methamphetamine, alcohol, I mean, our patients are using them all. Okay. And what's interesting is, let's say your drug of choice is opiates. If we say, okay, well, we're going to put you on MAT med for opiates, many of the other drugs they're using can get better at the same time, especially when we're putting you on those meds in conjunction with a structured program that you're working with. Then all drug use tends to kind of diminish. And sometimes initially it flares up and we see them replacing one drug for the other and they start using their second favorite drug more. But more often than not, that drug's not going to kill them tomorrow, whereas opiates will. So, MAT works really well for alcohol and opiates in particular, and new ones are in the pipeline. I think over the next few years, we'll see some of those coming out.
Awesome. We got about 4 minutes left here. Does anybody else have a question that we haven't heard from maybe? Let's do Deborah.
Hi.
Hey, Deborah.
Hi. I'm a mother. The son has suffered with addiction as well as benzos, and he started at 11 years old and is currently 28 years old. Just to give you kind of rundown. And I'm kind of wanted to mention to Joe, thank you for your story and thank you for sharing. And what I really liked about what you talked about and what parents and in my program as a parent of a loved one that's suffering with addiction is recognizing those things that I contribute to and contribute to the disease of addiction with my son and my husband, who are both addicts, that are doing their recovery in their program. But the whole thing I heard from you is that what I loved is that you became your own advocate. I love the fact that you were working harder on your recovery and finding out what was going to work for you. And that you made a point, as I heard you said, you spent the night there. You figured out, where you wanted to be, where you wanted to go. Because as a parent, I so wanted to try and fix it for my son, especially my husband. That's a different story. But with my son, it was obviously a struggle. And I knew all the right tools. I had all the right tools. I knew all the right things I needed to do until I started my own personal program and figuring out that I need to stay in my own lane and to allow my son to figure it out on his own, just like you did. I am so happy to hear your story, because working harder on your recovery is so important, because obviously what I did didn't work as a parent. And by working on myself and focusing on myself, my son too found that, medication-assisted treatment 9 years. And I will say, it hasn't been easy. And he relapsed. He went through, going through implants and programs. But it hasn't been perfect, but that's okay. And before, instead of me trying to create and try to tell him how to do and to make it better for him, he actually is figuring it out on his own. And it's I love hearing your story, because you made that effort to save your own life instead of your parents stepping in. Your mom actually had, sounded like they had to actually, stop doing for you what you could do for yourself. And that to me is your parents. I give your mom credit. That's a hard thing to do for a parent to give up and just stop doing. Another good thing you might want to consider is there's a lot of people at home that can't get their hair done, like myself. You might want to do a directional video to show them how to cut their own hair. We would love to see that. That could be a great job for you. Instead of having to go out and work somewhere, maybe do an online video. I know a plumber that's doing that, showing people how to unclog their toilets. There's a lot of things you can do. And so I'm so proud of you, and keep working on you, because you're worth it. And same with your mother. I hope she's getting the support and the recovery treatment for herself, and your mother and father. I don't know, who it is that your loved ones are, but thank you for sharing. And it gives me hope. I know that you're fairly new in this recovery, but it sounds like what I've heard, it's so promising, and you've got a great support system, a great program there. And just keep working on you, because it brings tears that somebody that you've taken and put yourself first, and making that point to make yourself be what you want to be, and to do that for your child too. Oh wow, that's just amazing. That just touches my heart so much, that you are putting your own child, just like I wanted to try and do, but obviously you need to be doing it. My son is an adult. He needs to do it for himself too. So thank you. And that's what I wanted to talk about. So if you wanted to respond to that.
Taylor, can we put his mom on the phone real quick to see how she's doing? I mean, she's been fantastic and so
yes,
patient.
Absolutely.
Jenna, are you still sitting up?
Yeah, I'm here.
So
perfect.
They're absolutely a remarkable family to deal with. It was, needless to say, kind of turbulent at the very beginning. but watching their relationship just get the way it is, it's like it brings tears in our eyes because they're so cool, it's just so cool.
Yeah. Yeah, I'd have to say me and my mom, she had no idea what to do with me and or how to, and she wasn't gonna give up, but she got to a point where she just didn't know what to do, I think. And yeah, that's where I really had to step in and because she made it that way, I had to be my own advocate and I had to figure this out on my own. And I think it was a benefit looking back on it now, but it made it very tough also.
But you needed it.
But I really think I needed that at the time because I needed to figure out, what I really wanted to do if I wanted to live or die. And so, yeah, it was super difficult at the time, but, looking back, yeah, I appreciate it. And what else was I gonna say? I forgot what I was gonna say. But love your mom, and I don't know if you want to say anything about.
I heard that, Jeanette.
Just how it was in the beginning.
Yeah. Awesome. Thank you so much for that. And anybody else here, please feel free to reach out to anybody. They have the information in the chat there for MyMac Clinic. Any questions for the doctor or the nurses, they have the number there with the email. And I want to thank everybody for being here, Doctor, as always, MyMac Clinic, as always, and the rest of the professionals. And Jody, absolutely. Without you, none of this would be possible right now as you brought us all together. Joe, you are remarkable. You're an example of hope. Thank you for being that inspiration for other people and making it out alive to show others that there is a way, and sharing your experience. It's something of so much importance for others. So thank you.